Hey, Dr. Matt Gianforte here today from LifeWorks Integrative Health, and today what I want to talk about is arthritis. So if you have joint pain, it's important that you listen to today's message, and the reason why is because we want to identify what type of potential arthritis that you may have in your body so you know the right way to go about handling that and treating that and getting to the root cause of your problem. So what is arthritis today? You know, arthritis affects 54 million people every single year in our country. It's actually the number one leading cause of disability. So it's something that we really need to understand, because so often as we age, we find that our bodies get slower, they get stiffer, our joints start aching more. And quite honestly, there's a reason for that. But we're going to talk today first about the 4 different types of arthritis so you understand where yours is coming from or could be coming from. So the most common type of arthritis that we have today is osteoarthritis. Osteoarthritis is going to affect about 30 million people every single year. Osteoarthritis is probably it is the most common cause or form of arthritis that we have. It's over 50% of all the cases of arthritis and the reason why people are getting joint pain. The second most common is going to be your inflammatory arthritis. So what does inflammatory arthritis mean? Because doesn't all arthritis have some sort of inflammation related to it? Absolutely it does. But inflammatory arthritis in particular is referring to arthritis as a result of your body attacking your joints. So rheumatoid arthritis, scleroderma, psoriasis, these type of arthritis is when your body's immune system starts to attack that particular joint. Treatments for this are going to be much different than an osteoarthritis, where it's more of a result of biomechanical and posture and injury and traumas. Where inflammatory arthritis is your body actually starting to attack itself. And so when you're looking at a treatment for inflammatory arthritis, you really have to take a look at what are you doing to stimulate your immune system. The third one here is infectious arthritis. So this could be a result of a bacterial infection, a viral infection, to which those infectious diseases or bacteria or viruses get caught into the joints and create inflammatory reactions. So every time you go and you move, that joint just aches and hurts and so forth. And the last one here is metabolic. Now, metabolic arthritis is primarily related to gout. So this is your inability to remove uric acid from your body. Some people do a very good job at it, others don't. And you're going to see this more commonly with people in their feet, in their toes, in their hands, and this one's less common for people, but it does happen. Now, the beautiful part about all of these arthritises is many of them can be prevented and you can be controlled without drugs and without medication. You just have to have the right professional looking at it appropriately. What I want to focus more on today is the one that's affecting over 55% of the arthritis population, and that's osteoarthritis. So if we break down osteoarthritis among different areas of the body, the most common area of the body that we see today that's affecting more people is arthritis of the spine, arthritis of the back. Back pain is going to be the leading area or disability within arthritis. The second most common type of osteoarthritis is going to be in the knees. And when we start to look at osteoarthritis, you know, a lot of people will say, well, it's genetics, it's age, it's how heavy you are. You know, all of those things play a very small role in osteoarthritis. And unfortunately, those sources or those reasons why arthritis can pop up are given way too much credit for the cause of the joint pain. If weight was the cause of your pain, you would see arthritis in every joint of the body. See, weight isn't discriminatory between the right and the left knee, or L5, L4 vertebra, and T1 and T2 vertebra. It's not prejudiced against different areas of your body. So yes, weight has some role to do with it, but it's not the main reason. The main reason why people's joints break down is these two things right here: posture and biomechanics. When the body is not operating or moving properly, the joints will wear down and break down quicker. So could weight play a role in a joint and breaking it down if their posture or the mechanics were not correct in that joint? Yeah, absolutely. That's where we're going to see an increase incidence with weight when your biomechanics and your posture are not right. And then the other thing is injuries and traumas. So injuries and traumas create ligaments laxity. It can actually cause muscles to spasm and not allow those joints to move properly. This then results in changes in biomechanics, changes in posture, and greater wear and tear on the joints. So what I want to do next is I want to go through the different phases of arthritis and how the typical treatment goes today for arthritis, and why today arthritis is really taking the wrong path because of how we're addressing the root cause of the problem. If we just look at a normal joint, and this is a knee joint, because this is the easiest one to draw. So if we look at a normal knee joint, arthritis is the inflammation of that joint internally, as well as the musculature, the tendons, and the ligaments around that joint. So let's take a look at the different phases now of arthritis. Okay, in this video I want to go over the different stages of joint arthritis. And so if we take a look here, there's really about 3 different stages of joint arthritis that happens. And the first one I want to talk about is just a normal joint, because really it's at this normal joint stage when we need to start taking care of our joints properly, okay? And many times at the normal stage, before pain ever develops, there ends up being a change in the movement patterns that start to create this inflammatory response and wear and tear that begins to happen. Now, our first sign that something is not going correctly typically is what? Pain. And that's how we've measured how healthy our joints are over the years when it comes to arthritis. And it's really not a very accurate way to consider or assess the health of our joints. What happens in the second stage of arthritis is the bones don't change that much. In fact, you're really not going to visibly see any arthritis on an X-ray or an MRI and any bony changes happening. But what you're going to experience is you're going to experience inflammation in the tendons, the ligaments, the joint capsule. So all the soft tissue around that joint, you're going to be experiencing more pain, which is a warning sign that something's not going right and you better take a deeper look. Some professionals out there are only going to look at an X-ray. An X-ray is not going to tell you a lot when you're in stage 1 of degeneration, okay? Oftentimes what we're going to do is we're just going to reach for an Advil, something over the counter, cover up the pain. Once the pain goes away, we think we're doing okay. And the reality is, it's just covering the problem up and you're continuing to progress in the wrong direction, which is why we see such an increase in arthritis now in our country, and it ends up being the leading cause of disability. So let's take a look at stage 2, because in stage 2, this has been years and years and years of running on your joints or using your joints and wearing them down and ignoring the pain signals in your joints. And this will start to break down the articular cartilage on the ends of those bones over time. Now, if you ignore this, where do you think you're going to go? Yes, you're going to go over here to stage 3. This is where we see a decrease in the space between those bones, and we're also going to continue to see the degeneration on the articular cartilage. So treatments with these 2 types of degeneration our typical medical standard of care for this is you're going to take probably a prescription anti-inflammatory, which is absolutely the wrong thing you want to do, because the issue is not because you don't have enough anti-inflammatory in your body, but the issue is because of a mechanical issue over the years. So you really want to work on correcting the mechanical issues. Or they'll go to something stronger, such as cortisone. And for those of you that have actually done the research on cortisone, which I find many people don't before they put it into their joints, cortisone will weaken the joint, break the tissue down faster, and it's something that we want to start avoiding when it comes to osteoarthritis and joint pain. That will continue to break down if we don't handle it, and we get to this stage where the joint space has decreased. This is many times where people are going to look for surgery to have their joint replaced, maybe have meniscus cleaned out even more. We're going to have a lot of problems here, and really the medical solution to this is going to be surgery, replace the joint. And unfortunately, this is kind of a standard of care when it comes to joint pain. Wait until it continues to get worse and just cover it up, and then it leads us to surgery. So be proactive rather than reactive. And I'm going to do another video that talks about the stages of arthritis again, but as well as a different path so we can be more proactive than reactive.